Erectile dysfunction. Is your erection about to fail? You have no problem getting an erection, and keeping it up until you and your partner are both satisfied. But even if your penis is humming along just fine now, there could still be some issues lurking beneath the surface. That's right, even if you're getting an erection with no problem now, you still may be well on your way to erectile dysfunction. Penis problems generally don't just pop up out of the blue, though. In many cases, especially if we're talking about a physical cause of erectile dysfunction, rather than a mental one, there are certain signs that can serve as a harbinger that issues may be brewing. Sometimes, a minor erection issue could be a sign that you're headed towards disaster in the sack. It could also be your body's way of telling you that you have another, more serious concern to deal with, explains Adam Ramin, MD, Medical Director of Urology Cancer Specialists in Los Angeles. So no penis problem should be ignored. Here, 7 unexpected signs that can point to erectile dysfunction down the line, and what you should do if you notice them. Erectile dysfunction sign: you haven't woken up with morning wood in a while. Nighttime and early morning erections have nothing to do with feeling aroused, they happen because your brain releases less noradrenaline, a hormone that keeps erections from happening nonstop, during sleep. Having frequent morning wood is a good thing, since it indicates the blood vessels that allow blood to flow to your penis are healthy, says Dr. Ramin. If you start noticing that you're waking up with an erection less often than usual, that could mean that those blood vessels aren't working as well as they should, making it harder for blood to flow into your penis to become erect, Dr. Ramin says. That means the same issue impeding your morning wood might eventually rear up in the bedroom, when you're actually trying to get hard. Now, there's no magic number that means you could be in trouble. It's any amount that's different than your normal that raises the red flag. Erectile dysfunction sign: you don't think about sex as much as you used to. If the stuff that usually gets you going just isn't working anymore, there's a good chance that your testosterone levels are lower than normal. Testosterone is the main hormone responsible for your sex drive, explains New York-based urologist and sex expert David Shusterman, MD. If it plummets, your desire to get going in the same way, too. And if you're not really in the mood, getting hard will be next to impossible. Along with a lack of sexy thoughts, you may also notice some other signs of low testosterone, like fatigue or mood changes, difficulty building muscle, or even developing a gut. Taking ibuprofen could negatively affect your sex life, a new study reveals. Researchers found that taking 6 tablets of the painkiller each day can make your balls shrivel up, reducing fertility levels. Erectile dysfunction, muscle loss, depression and a loss of libido, have also been linked to the common drug. Researchers have developed a new gel formulation for the treatment of erectile dysfunction. This gel formulation contains nitrates or nitroglycerine that is being used to treat angina, chest pain, and also an important ingredient in making explosives. The oily, colorless liquid that is prepared using nitroglycerine has been found to work 12 times faster than Viagra. It also acts by releasing nitric oxide gas, or NO. NO is responsible for immediate widening or dilatation of the blood vessels of the penis over which it is applied. This leads to erection. The blood flow to the penis increases remarkably. According to researchers, the best advantage of this formulation is its ease of use and fast onset of action. The gel, however, like most other drugs that contain nitroglycerine, leads to side effects such as headaches, hot flushes, nausea. Alteration of some of the components could address this problem, say the scientists. This gel is in for further studies and human trials until it is deemed safe and effective for use among humans. It is being speculated that the gel formulation could cost as little as £1. It is found to be most effective among those with mild forms of erectile dysfunction, say researchers. Erectile dysfunction is the most prevalent of the male sexual dysfunctions, Prevalence age 30 to 80 years, at 19.2% as compared to 31% for all types of male sexual dysfunctions. It has deeper physical as well as psychological impact, and a treatment that is non-invasive and effective would be more than welcome.